Good morning. My name is Dr. Olusegun Ogboye. I'm the Permanent Secretary in the Lagos State Ministry of Health. For those who may not know, Lagos State is a small state in terms of land mass in Nigeria, but it has the highest population of all the 36 plus 1 states in Nigeria. And it is the commercial capital of Nigeria. I had hoped to be here to present to you in person, but unfortunately I couldn't make it, and so I'm doing the next best thing. The outline of my presentation, I will start with the Lagos State background, giving you some information about the state, and then I will go into our current family planning indices, the strategic government leadership for family planning and urban health, funding sources for family planning in Lagos. I'll talk about bottlenecks in leadership and health financing for family planning, and then I'll attempt to give a little conclusion on this presentation. So as a bit of a background on Lagos, you can see from our map there, it's a very small landmass, but we have a total population of over 28 million people, an annual growth rate of 3.24%, an immigration rate of about 89 persons per hour, which is made up of people moving from rural to urban areas, people moving from nearby states, and also people moving from our nearest country neighbors. So we get about 89 people moving in per hour. We have women of reproductive age of about 6.19 million, and it's administratively divided into 20 local government areas, 37 local council development areas, 376 wards, 320 primary healthcare centers, 28 public secondary healthcare facilities, 5 public tertiary healthcare facilities, 4,421 private health facilities. The total fertility rate, as I've alluded to earlier, is 3.4%. The modern contraceptive prevalence rate is 29%. The maternal mortality rate for the whole of Nigeria is 512 per 100,000 live births. For the prevalence of all methods contraception is 49.4%. The unmet need for contraception is estimated to be 16.5%, and demand satisfaction is estimated at 41%. Regarding the strategic government leadership for family planning, in terms of coordination, the State Family Planning Sub-Technical Work Group meets quarterly to plan and coordinate family planning activities, including the development of an annual operational plan that's drawn from a 5-year costed strategic plan. Members of the TWG include staff from the Lagos State Ministry of Health, staff from our implementing partners, clinical and non-clinical private sector partners, TBAs, donors, and other line ministries. Regarding funding, funds for family planning activities are released through annual budgetary provision and inclusiveness of local partners and implementing partners to implement high-impact activities as specified in the costed strategic plan and the annual operational plan. In terms of quality expansion of family planning service delivery into the private sector, the clinical and non-clinical private sector, through the patent and proprietary medicine vendors, our community pharmacists, the TBAs, and through community outreaches reaching about 60% of the Lagos population. And then we conduct integrated supportive supervision to our public health facilities, and we also conduct capacity building for the service providers through on-the-job training to improve quality of family planning service delivery. In terms of policy, there's a task-shifting, task-sharing policy. There's an adolescent and youth reproductive health strategy, and there's a policy that allows women to stay at home for 6 months after their first 2 deliveries. In terms of private sector engagement, we partner with the private sector to ensure their data is captured on the district health information system. We conduct capacity building for private sector providers, and we supervise and regulate their service provision through the regulatory arm of the Ministry of Health. We conduct social marketing for commodity supply, and for family planning provider network. We collaborate and have a referral network between them. Family planning and urban health. As I told you before, Lagos is a mega city with a daily influx of people into the state. And this results in a lot of pressure on the services, the infrastructure in the place, even though we have only a total fertility rate of 3.4%. There's a rich crop of private sector health providers, and there's a need for intentional engagement with the private sector. We have a large youth population, placed at estimated to be about 54%, and we leverage on the adolescent health window through our youth-friendly centers, such as something called the Hello Lagos centers, and our young moms clinics for inclusion of family planning services. Family planning is key to ensuring population control and improved urban health by reducing the strain on existing infrastructure. Integration of family planning into maternal child health continuum of care through ANC, through delivery, through postnatal care, through immunization, etc. The point is to catch the women at any whatever point of contact and to engage about family planning. Another way is to ensure that we increase awareness about family planning using commemoration of days such as the World Contraception Day. What are the funding sources for family planning in Lagos State? Primarily, government has a budget line for reproductive health activities in the state, and this includes family planning. Then we have health insurance, which is funded through the Lagos State Health Management Agency, and this provides full family planning cover except for surgical processes for permanent family planning. Then donor funding support for activities that are in our annual operational plan, and there's an unquantified funding from the private sector. This slide shows us the trends in family planning budget allocation and release in Lagos between 2017 and 2022. Those who are familiar with how government works understand that there's a difference between allocating money in a budget and actually getting it released for implementation of activities. So in 2017, we had a budget allocation of 54 million and no release. In 2018, we had a budget allocation of 66 million and we had a release of about just under 2.5 million naira. And in 2019, we had a budgetary allocation of 90.5 million naira and a release of 53.932 million. In 2020, many of us will remember that was the COVID year. We had a budgetary allocation of just over 175 million naira and a release of just under 10 million naira. By 2021, this had improved, and we had a budgetary allocation of just over 132 million, and a budgetary release of just under 59 million. What are the best practices for seamless funds release in Lagos State? A health financing and policy strategy that articulates the state's strategic objectives and implementation strategies for each of the three functions of the health financing, including revenue generation, pooling, and strategic purchasing. We have community-based health insurance and the Lagos State Health Management Agency insurance. We have a functional costed strategic plan and annual operational plans that are developed annually from this. Then we make prompt requests and get prompt approval now for activities that are in the annual operational plan. We conduct capacity building and coaching of program managers on memo development and resource mobilization. What are the bottlenecks that occur in leadership and health financing for family planning? There's insufficient public sector allocation and release, the too many competing needs for government. There's dependence on donor support. There's limited visibility of the private sector. They could do a lot more. There's a lack of understanding of the impact of family planning investment by non-health sector players. And these include the people who hold the purse strings, and sometimes it's really difficult to justify to them why funding family planning is very, very important for development. And then, of course, there's the issue of inadequate human resources for health. Staff are leaving, healthcare workers are leaving in droves out of the country. In conclusion, investing in family planning would dramatically reduce the high incidence of unintended pregnancy, unsafe abortion, and the associated burden of maternal mortality in Nigeria. Investments in family planning optimizes women empowerment and productivity, thereby breaking the chain of generational poverty associated with pregnancy-related school dropout rate. By saving lives and improving women's health and well-being, sexual and reproductive health care benefits individuals and families and contributes to countries' social and economic development. Greater partnership with and cooperation of the private sector is key to advancing the family planning agenda and ensuring optimal benefits for all stakeholders. Family planning matters, family planning pays, urban development is a must for all. Thank you very much for listening. Enjoy your deliberations. Thank you.